Minister Matthews, take us through the Excellent Care for All Act and what that has meant.
Well, some people have said this is the most important piece of legislation since the introduction of universal health care in Canada. So it's a big deal. What it means is we're going to start focusing on quality improvement. We're going to put renewed emphasis on evidence, and all of this from the perspective of the patient, providing patient-centered care so that the journey that a person has through our healthcare system is what we want to focus on, not the old-fashioned silos of care that we have built up over time. So it's a very big deal, and it's really important as we focus more and more on the sustainability of our healthcare system. A lot of people are arguing that our healthcare system is not sustainable. I reject that argument. What I argue is if we actually focus on evidence, if we focus on the patient's journey and improving the quality of care along that journey, we will have that universal health care that is so precious to Canadians. We'll be able to protect it, strengthen it, and pass it on to future generations.
Minister, what will it mean for organizations like the LHIN?
Well, the LHIN is perfectly positioned to drive the kind of change that we must see in order to protect our healthcare system. So, because the LHIN is responsible not just for parts of the healthcare system, but the whole continuum of care, they can drive the kind of change we need to see.
And when you talk about silos, take us through what the hope is there, because that sounds very interesting, very intriguing.
Well, what we know is that when people go to the hospital and get admitted to the hospital, they receive excellent care within the hospital. But what happens when they move out of the hospital into another part of our healthcare system, that's where people can fall through the cracks, and so it's providing the continuum of care, so that the CCACs are in the hospital preparing for home care while someone's still in the hospital before they've been discharged, so that discharge happens smoothly, that people get the support they need to stay out of hospital. So it's really about providing that continuum of care, because it's unusual that people actually, especially as they age, it's unusual that they just need episodic care. They need the continuum of care.
All right. Thank you very much.
Thank you.